Here are 50 MCQs on adenomyosis with answers and one-sentence rationales. Adenomyosis, 50 MCQs with answers and one-sentence rationales. 1. Adenomyosis is defined as A. Endometrial tissue outside uterus. B. Endometrial glands and stroma within the myometrium. C. Myometrial overgrowth. D. Fibroid degeneration. Answer B. Rationale: adenomyosis is characterized by ectopic endometrial tissue within the myometrium. Hanner 2. Most common symptom of adenomyosis is A. Amenorrhea, B. Dysmenorrhea, C. Dyspareunia, D. Postmenopausal bleeding. Answer: rationale. Painful menses is the most frequent complaint. Adenomyosis most commonly occurs in women of A. Adolescence, B. Early 20s, C. Reproductive age, D. Postmenopausal period. Answer C. Rationale: it predominantly affects multiparous women in their 30s to 40s. 4. Risk factor for adenomyosis: A. Nulliparity, B. Multiparity, C. Early menarche, D. Late menopause. Answer B. Rationale: multiparity increases disruption at the endometrial-myometrial junction. Hanner 5. Classic uterine finding in adenomyosis: A. Small, firm uterus, B. Enlarged globular uterus, C. Irregular uterus, D. Fixed uterus. Rationale: adenomyosis typically results in diffuse uterine enlargement. 6. Best imaging modality for adenomyosis: A. X-ray, B. CT scan, C. Transvaginal ultrasound, D. Mammography. Answer C. Rationale: TVUS is widely used and effective in diagnosis. 7. MRI findings suggestive of adenomyosis: A. Thin junctional zone, B. Junctional zone thickening 12 millimeters, C. Endometrial polyp, D. Calcifications, B. Rationale: JZ thickening 12 mm. 8. Adenomyosis is often associated with A. PCOS, B. Tubal blockage, C. Endometriosis, D. Hyperprolactinemia. Answer C. Rationale: endometriosis and adenomyosis frequently coexist. 9. Type of adenomyosis most common: A. Focal, B. Diffuse, C. Cystic, D. External. Rationales: most cases are diffuse infiltration of the myometrium. Cheshire 10. Gold standard for definitive diagnosis: MRI, B. TVUS, C. Histopathology after hysterectomy, D. Laparoscopy. Answer C. Rationale: final diagnosis is by histological examination. 11. Treatment of choice for symptomatic adenomyosis in women finished childbearing: A. NSAIDs, B. OCPs, C. LNG-IUS, D. Hysterectomy. Answer D. Rationale: hysterectomy is curative. 12. First-line treatment for pain relief: A. GnRH agonists, B. NSAIDs, C. Hysterectomy, D. Progesterone injections. Answer B. Rationale: these reduce prostaglandin-mediated pain. 13. Hormonal treatment that is highly effective: A. Estrogen patches, B. LNG-IUS, C. Testosterone, D. Bromocriptine. Answer B. Rationale: LNG-IUS decreases bleeding and pain. 14. GnRH agonists work by A. Increasing estrogen, B. Decreasing estrogen, C. Stimulating ovulation, D. Improving blood flow. Answer. Rationale: GnRH agonists suppress ovarian estrogen production. Chesh 15. Adenomyosis usually presents with A. Hypomenorrhea, B. Menorrhagia, C. Postcoital bleeding, D. Intermittent spotting. Answer. Rationale: heavy menstrual bleeding is common. 16. Adenomyosis versus fibroids: adenomyosis typically causes asymmetrical uterus, B. Cyclic pain, C. Sharp localized pain, D. Submucosal masses. Answer. Rationale: cyclic severe dysmenorrhea favors adenomyosis. Has 17. Which is not a typical symptom: A. Dysmenorrhea, B. Menorrhagia, C. Infertility, D. Hot flashes. Rationale: hot flashes are unrelated. Adenomyoma refers to uterine cyst, focal adenomyosis, C. Leiomyoma, D. Endometrial hyperplasia. Rationale: a localized mass of adenomyosis is adenomyoma. 19. In adenomyosis, the uterus is typically A. Tender, B. Rigid, C. Mobile. Non-enlarged. Answer. Rationale: and tender uterus is characteristic. 20. Adenomyosis is a premalignant condition, B. A benign uterine disorder, C. Caused by bacteria, D. A genetic syndrome. Rationale: adenomyosis is benign. 21. Estrogen exposure tends to A. Reduce adenomyosis, B. Worsen symptoms, C. Have no effect, D. Cure the condition. Rationale: adenomyosis is estrogen responsive. 22. Adenomyosis tends to improve: A. At puberty, B. After pregnancy, C. After menarche, D. After menopause. Answer D. Rationale: symptoms regress when estrogen declines. A typical ultrasound feature: A. Snowstorm appearance, B. Heterogeneous myometrium, C. Endometrial thickening, D. Ovarian cysts. Answer B. Heterogeneous myometrium suggests adenomyosis. 24. Best fertility-preserving medical therapy: A. Hysterectomy, B. GnRH agonists, C. OCPs, D. LNG-IUS. Answer D. Rationale: LNG-IUS helps control symptoms without removing uterus. 25. Adenomyosis increases risk of A. Ovarian torsion, B, miscarriage, C, hypertension, D, breast cancer. Answer, it is associated with impaired implantations. Typical MRI appearance: A, bright uniform T2 signal, B, myometrial cysts, C, calcified ring, D, fatty streaks. Rationale: myometrial cysts support diagnosis. 27. Adenomyosis often coexists with A, pelvic inflammatory disease, B, cervical cancer, C, endometriosis, D, ovarian torsion. Answer C. Rationale: up to 50% coexistence with endometriosis. 28. Most conservative surgical option: A, myomectomy, B, adenomyomectomy, C, oophorectomy, D, cervical conization. Answer B. Rationale: focal excision preserves fertility. 29. Uterine artery embolization UAE helps by A, increasing blood flow, B, shrinking adenomyotic tissue, C, removing uterus, preventing ovulation. Answer: rationale: UAE reduces adenomyotic lesions. 30. Symptom severity correlates with A, uterus size, B, number of gestations, C, BMI, D, blood pressure. Answer: rationale: larger involvement causes stronger symptoms. 31. Adenomyosis is due to A, fungal infection, B, invasion of endometrium into myometrium, C, hormonal deficiency, D, genetic mutation. Answer: rationale: it is defined by endometrial invasion. 32. Ultrasound sign: A, whirlpool sign, B, Venetian blind shadowing, C, ring of fire, D, cogwheel sign. Answer B. Rationale: this represents shadowing from heterogeneous myometrium. 33. A patient with adenomyosis often experiences A, painless cycles, B, chronic pelvic pain, C, sudden acute abdomen, D, irregular spotting only. B. Rationale: chronic pelvic pain is common. 34. Adenomyosis is more common after A, C-section, B, appendectomy, C, oophorectomy, D, breast surgery. Answer: a rationale: uterine trauma predisposes to invasion. 35. A hallmark symptom: A, mid-cycle pain only, B, progressive worsening dysmenorrhea, C, random sharp pain, D, breast tenderness. Rationale: pain worsens over time. Best imaging for differentiating adenomyosis from fibroid: A, MRI, B, CT, C, PET scan, D, X-ray. A. Rationale: MRI offers the best soft tissue detail. 37. Adenomyosis may cause A, hyperthyroidism, B, anemia, C, diabetes, D, jaundice. Answer B. Rationale: heavy bleeding can lead to anemia. 38. A focal cystic variant is called A, chocolate cyst, B, adenomyotic cyst, C, dermoid, D, follicular cyst. Rationale: a cystic pocket in myometrium indicates cystic adenomyosis. 39. Adenomyosis pain is typically A, non-cyclic, B, cyclic and progressive, C, postcoital only, D, related to urination. Rationale: pain aligns with menses. 40. JZ thickening threshold on MRI: A, 5 mm, B, 8-12 mm, D, 15 mm. Answer C. Rationale: 12 mm strongly indicates adenomyosis. 41. Adenomyosis most affects which portion of uterus? A, endometrium, B, myometrium, C, cervix, D, ovaries. Answer B. It is a myometrial disease. 42. Common complaint: A, weight loss, B, heavy painful periods, C, persistent vomiting, D, urinary retention. Answer: rationale: classic symptom combination. 43. LNGIUS works by increasing estrogen, B, delivering local progestin, C, removing endometrium, D, shrinking ovaries. Answer B. Rationale: local progesterone reduces symptoms. 44. Best option for future fertility: A, LNGIUS, B, hysterectomy, C, endometrial ablation, D, bilateral oophorectomy. Answer A. Rationale: LNGIUS preserves reproductive ability. 45. Most common differential diagnosis: A, endometrial cancer, B, fibroids, C, cervicitis, D, pelvic prolapse. Answer B. Rationale: both cause uterine enlargement and heavy bleeding. 46. Reproductive impact: A, improves fertility, B, no effect, C, causes implantation failure, D, causes hyperovulation. Rationale: abnormal myometrium impairs implantation. 40. Definitive cure: A, OCPs, B, LNGIUS, C, GnRH agonists, D, hysterectomy. Rationale: removal of uterus eliminates disease. 48. Adenomyosis may coexist with which benign tumor? A, fibroma, B, leiomyoma, C, adenoma, D, osteoma. Rationale: fascianoids frequently coexist. 49. Expected physical exam finding: A, small uterus, B, soft globular uterus, C, high cervix, D, narrow pelvis. Enlarged boggy uterus is typical. 50. Adenomyosis is often misdiagnosed as A, PID, B, fibroids, C, cervical dysplasia, D, ectopic pregnancy. Rationale: symptoms in uterine enlargement mimic fibroids. Thank you. Have a nice day.